Hey guys, it is September 12th and tomorrow marks my 2 years and 9 months on T. So physical changes. I noticed that my muscles, without me even doing anything, I haven't been able to do anything with these couple surgeries, but my muscles in my chest and my quad muscles continue to shape and get hard. Hair, my fingers now have patches of hair. I haven't gotten it down here, don't know if I will, but they're definitely coming in black right here. I've got, of course, I showed you this here is all full of hair. My sideburns are coming in thicker, so the stash is still getting there. Tony likes it. I'm not sure if I like it yet. I just don't know yet. I saw recently, well, I'll go into that in a minute after physical changes. So fat is still redistributing. I've talked about I have a spinal cord stimulator, and I've got 2 leads that are along my spine, and on the bottom of my, well, at the top of my right hip, I have a battery pack that those 2 leads lead to. And that battery pack prior to T was totally, you could feel it if you rubbed it, but the fat was all around it. So yeah, I had a lot of extra fat there. Now it protrudes and you don't have to look for it, you can just see it. So that's where the fat's coming off, excuse me, my buttocks, and going around into my stomach or somewhere else. Guys in the back right here, if you ever notice, it's almost like their fat is flat and thick like this on the back, and I've noticed mine shaping like that. I don't know if I'm explaining it well to where you guys understand, but they just look different from the back. I don't feel the vibration in my throat anymore, so I don't, maybe it's I can feel the depth of my voice, but I don't have that scratchy feeling any longer, or the vibration that was really noticeable. So other changes, my ears have gotten a little bit bigger. I used to have really not small ears for my body, but I didn't have big ears for my body. And my hairline continues to recede, as you can see. My hair is thinning out on top, which I think when I really implement the juicing more, I think that'll all, my hair will get healthier. No, I don't have any balding on either side, so we'll see where that goes. It could come down from generations, but as far as my family on both sides say, they haven't had any baldness. Emotional changes. Okay, so I've been doing some videos regarding bottom surgery, and I'm tossing that around trying to decide which surgery I feel is best for me. I haven't even I know what I want, but there's so much that I need to really consult the doctor with himself in order for me to feel like that is what I can do. I deal with Hashimoto's, and Hashimoto's thyroid disease, basically what it does is it causes some skin problems. You've got dry skin, they don't heal as well or as quickly as they should. And then I've got, and I don't know if this has to do with the Hashimoto's or not, but my body rejects sutures. And what I mean by that is when I had my feet surgery, my first foot surgery, the dissolvable sutures that they do in the underlining of their incision, that suture worked itself up to the top, and my foot didn't get infected, but it was pussy because it was trying to reject that. So it's not like I had to go on antibiotics, but at the time we were on a cruise, and we have a friend who's a nurse practitioner actually, and a doctor in our group, and they said just put hot tea bags on the incision and to draw that out, and if they have to, they'll snip it. So that's my concern too, because when I had my laparoscopy, or actually they took out the last ovary I had embedded in my pelvic, the two incisions, the three incisions that she did, they worked the dissolvable suture out, and she had to go in and cut them and kind of reopen some of the areas to get to them, and then I had to pack those incisions, and that is very painful. I don't know if you've ever had to pack anything. It's not like you have to take a pain pill over it, but it's an acute painful feeling. So that's another thing that I have to consider and discuss with him about. Now, I'm not in a rush. I'm not going to get on a cancellation list. When I make a date, I'm going to keep that date, and what it'll do, he's already booked, I think, through June, July, August, I don't know, of next year. And that's okay with me, because after consultation with him, I know he's going to ask me to lose some weight, and I'm losing just slowly, and that's the way I want to lose. I don't want to lose it fast. I'm not changing my diet. The only thing really that's changed is my protein drinks fill me, so I'm basically only eating 1 meal a day, because by the time I'm hungry, it's time for dinner, or I eat a snack. I'll snack on some almonds or a piece of fruit, because it's too late to eat lunch because Tony's going to be home and we eat dinner together. So I kind of do that, and I notice that when we eat dinner, I don't eat a whole lot. I'm full, and we do try to make it nutritious. And then if I get a little hungry or want like a dessert, I'll make another protein drink, and I'll make it like a Frosty or a Slurpee, that kind of thing. So it's been working out well for me. I enjoy my shakes. I change them up. I don't get burnout on anything. I put chocolate cacao in it. I think it's 85%. I'll put a couple squares in it if I feel like some chocolate. Berries, you know, strawberries, blackberries, blueberries, raspberries. I freeze bananas. I break the bananas up and I freeze them, and so I'll put a frozen banana in there. Peanut butter, we buy. I'm so everything's we. If I say I, it's still Tony and I. But I do all the grocery shopping and stuff, that's why I guess I say that. But I pick up the organic peanut butter at Fresh and Easy, and the ingredients is only roasted peanuts and sea salt. So that's what I use, and if I feel like peanut butter, and I'll put some chocolate in there too, because I love, my weaknesses is like peanut butter and chocolate. Whatever mixture you want to put in there, I love peanut butter and chocolate together. I'm a big peanut butter eater. I have really cut it down since my triglycerides went clear up to 400. I was sick, and I had a cocci infection, and that's all I ate was just peanut butter and toast, and it was just it really shot my triglycerides up. So I've cut that down a lot. I have it in the shake every once in a while. So as far as bottom surgery and my emotions going that way, I am going to have it. Tony and I have discussed it, so I know what I want. It's just what is best for me, what is best for my body, because I don't want my body to reject anything and have complications on top of the possibility of other complications that usually happen. So that's what's going on as far as the bottom. My aunt and uncle came out from Tennessee, and I was really, really nervous about seeing them. Not necessarily my aunt, because I saw her last year, but I haven't seen my uncle. And this is my dad's baby sister, and my dad's oldest sister had emailed me and had said that she thinks what I've done for myself is the best thing I could do for myself. She supports me 100%. And she said, although back here not everyone agrees. So I wasn't sure who's talking about me. She didn't throw names out, and I wasn't sure if it was my uncle and my aunt talking behind my back. So I wasn't sure if I really wanted to go confront, or not confront, but see them and then have him call me just by my birth name and not even try. So what happened is, my mom kind of put me on a guilt trip, not knowing if we'll see him again. And so I went over there, and they both hugged me, but when he hugged me really tight, and I could feel that he really loved me. And he did say, "How you doing, girl?" And I think he got embarrassed. I didn't give him any attention. I didn't give him a look or anything. I just thought to myself, oh boy, here we go. But after that, he was kind of like, when you've kind of said something and it might have embarrassed somebody, but you didn't mean to, how you kind of try to talk to him and just kind of, I don't know how to explain it. Maybe you guys know what I'm talking about, but you'll just kind of talk to him nice and just like basically say, oh, I didn't, in the way your mannerisms are and your approach is basically saying, I'm sorry what I just did, without saying it. And that's what he did. And so they never called me by a name, and they never called me by a gender. So they kept this conversation pretty, flat as far as that's concerned. And I appreciate that, because that's respectful, and considering what I was expecting. So anyway, other things that are going on emotionally, what I've noticed is I'm just becoming more and more just not wanting to deal with a lot of drama. I mean, when people share drama with me, I'm like, I'll listen to them, and I'm just thinking, oh my gosh, how can people just keep going on with this stuff? And so I don't know if it has anything to do with the hormones and what I'm carrying now, as opposed to just my age, being disabled. I'm somewhat of an introvert. I can socialize, and I can speak in front of crowds, but I have like inner anxiety. I get nervous. And so crowds just bug me. I don't know what it is. Even if I'm around a large crowd of friends. Now, we had our first Monday night, girls. We had our first Monday night football. We hosted. We kicked the season off, and it was great. We had a great time, because I only invited the regulars. I didn't open the door for the regulars' friends and their friends. We used to host first Monday night football, and we get about 40-45 people. I stopped doing that when people started going through our house and going through our cupboards that we didn't know. And I said, nah, we're very open and we welcome everybody, but that's crossing the line. So I stopped doing that. And it's been working out well for us. So, I noticed I was fine. We lost a good friend of ours over the summer to cancer. She fought for 2 years. And our friend, her partner, well, her and I have known each other 20 plus years. So I did a little speech and a memorial thing for our dear friend, and I don't have a problem doing those things. So I don't know if really I'm an introvert, or I just have a little anxiety in big crowds. So I don't know. Tony's loving my hair. She's loving the changes. She loves the mustache. it gets a little embarrassing though, because sometimes she'll just be staring. I go, what? She goes, I can't believe your changes. She goes, I can tell in your neck, I can tell that in your jaws kind of changed, the way you're shaped. I don't have the snoring problem that I used to have when I sleep. It would keep her awake. I can sleep on my back now and actually breathe. I do have a sinus issue, and that always helps. When I have surgery, my sinus issue seems to go away for a while. Now it's coming back, but I've been sleeping really good prior to it coming back. I'm doing good. I hope all of you guys are doing good. One thing I've noticed is, you know, I've said it before and I'll say it again before I run out of time here. I'm getting close to it. Is don't be impatient with your family and stuff. If they're not doing it on purpose, take a deep breath and just let it go. Don't put anything on your shoulders that you don't necessarily need on them and weigh you down. So I'm going to get off here. I hope everyone is doing well, taking it one day at a time, and I hope you're making your journey as simple as possible. Take care, guys. Bye.